Hi everybody, my name is Dr. Steve Truch, and I'm going to talk to you a little bit right now about dyslexia. So dyslexia is a much bandied term, and I think what I'll just quote here is Dr. Jack Fletcher's quote, or the definition of what dyslexia is. And he said it is a word reading disability. So just think about those terms, word reading disability. So we're talking about a single word. Now it's a disability or a delay. So let's talk about that a little bit. We all know, I think if you've taken any kind of courses in statistics, that when you measure people on any kind of variable, let's say we're talking about a reading or spelling or comprehension, if you sample several thousands of people across the population, you're going to get what's called a bell curve, the normal curve. So the normal curve is a graphic display of the degree to which the scores in the population are gathered. So those scores fall on a continuum that is graphically represented in this bell-shaped curve. So in the middle, we have, say, a standard score of 100, usually that's a typical score, which represents the midpoint of that distribution of scores, the 50th percentile. So if you have a child who scores 100 on a reading test, that's where they stand, right in the middle of the population group. Now, if they are delayed, which are the kinds of readers that we mostly deal with, they will vary by degrees. They might be delayed by 5 standard score points, by 10, by 15, by 20, by heavens, maybe even 40. So you get these degrees of delay. The closer you get to those finer levels, those most delayed degrees, you're talking about a population that we would call also dyslexic. These are children who have severe difficulty in not only sounding out words, learning them, but also in remembering them. So in order to improve them and start closing the gap between where they are and where they could be, we have to know where they are. So we do pre-testing. We have to apply what we know to the individual needs of that particular student. We have to give them the one-on-one instruction, preferably intensively, that we know works very, very well with them. We need to monitor their progress as they're going through the program. We need to adjust for their individual differences as they are going through the program. We need to provide feedback to parents as they're going through the program. We need to post-test. We need to be accountable, in other words, and we need to show what we can do for that student. So give us a call. We'll be happy to discuss any questions you have about your child's needs and be happy to provide you what we can do, provide you information about what we can do for them. So thank you very much.